Hello and welcome to another surgery coding review where today we're going to focus on the 40,000 series of our 2020 CPT code set. I'm sure by now you've had a little time to recover from the 30,000 series. It definitely had a lot of things going on. So the 40,000 series begins on page 301 in your 2020 CPT manual. And just like the rest of the sections of the surgery section, the digestive system is divided by anatomical site. And then after the anatomical site, you have the different procedures that can be performed for that particular body part. And so we pretty much start at the beginning of the digestive system with the lips, and then the codes wrap up with procedures down at the bottom of the digestive system, all the way down to the anus. Just like other sections, very important for you to watch what your doctor did so that you can select the appropriate CPT code. Also keep in mind that all of the different procedures that a provider does to actually do the procedure are typically not coded because they're considered bundled into that surgical procedure code. So we're going to start on page 304 with the body system of lips. And under lips, let's take a look at excision. And under excision, you see excision of lip. Let's start there. So one of the things that you'll want to notice regarding the excision of the lip is that we have several options that identify what happened as a part of the excision of the lip, which regards to closure and reconstruction that might have been performed for that procedure. Now, a little further down, under repair of the lips, we have repair codes. And notice that the codes are divided based upon which part of the lip was actually repaired. Immediately following that, we have plastic repair of cleft lip, nasal deformity, and you'll notice that the first code is listed as primary, partial or complete, and unilateral. And then when you go to the next two codes, you have primary procedures, but they're bilateral and they're divided based upon if it's one stage or one of two stages. Now, there's something to note with those particular codes. So number one, don't forget, whenever the code has bilateral in the code description, you do not add a modifier 50. Additionally, if the code reflects a stage, you do not use a modifier 58. All right, so from there, we're going to go on over to the vestibule of the mouth. And it starts off with a little paragraph for you to take note of. And then under incision, we have drainage of an abscess, which is divided into simple and complicated. Now, you probably are thinking, wait a minute, didn't we have drainage of an abscess in the integumentary system? I'm sure you're thinking that because we did. However, what you'll want to remember is if the procedure is done on the skin, the external part, that's integumentary. But if it's inside of that organ, you're going to be coding it to that system. That's something to remember. So the drainage codes, again, divided into simple and complicated. And then as it relates to removal of embedded foreign body, which are the next two codes, those are also divided into simple and complicated. A little further down, we have under excision destruction, we have excision of a lesion of the mucosa and submucosa, the vestibule of the mouth. Now, here again, we had excision of a lesion in the integumentary system, but they're all the way in the mouth, so it's not coated with skin. And then also you'll notice that these codes are divided based on the type of repair that was done. Now, the other thing I want you to take note of, if you notice on page 304, under lips excision, you see biopsy of lip. But under vestibule of mouth excision, destruction, you also see biopsy again. The key here, pay close attention to what body part your provider was working on and actually what they did. Lastly, under the vestibule of the mouth, under repair, we have a vestibuloplasty. And what you'll want to note here is that they're divided based upon if it's anterior or posterior. And then there's an option for posterior unilateral and posterior bilateral. Don't forget about those subsection notes as well as your parenthetical notes, because they really truly do tell you how to code from that particular code family. All right, so next up, we're going to go over to page 305 with the tongue and the floor of the mouth, and we're going to start off with incision. Now, immediately, the very first thing that I want you to take note of, and hopefully you have decided if you're going to be doing some type of highlighting in your manual or underlining. But what I want you to know under excision is that 41000 is intraoral incision and drainage of abscess, cyst, or hematoma of the tongue or floor of the mouth. But when you go down to 41015, notice it says extraoral incision and drainage of abscess, cyst, or hematoma of floor or mouth. Now, one of the reasons that I enjoy doing this type of video series is that oftentimes when you're taking a national exam, this is how they trick you, where there's, one word difference and you are, picking your code and you're like, oh, it's 41015 when it was actually intraoral. Or another example, in the same two code families, 41008 says submandibular space, but 41017 also says submandibular space. All right, still under the tongue and floor of the mouth on page 305. Excision starts off with a biopsy of the tongue, but I also want you to notice that there's a biopsy for the floor of the mouth. So you gotta pay attention to what the doctor did. Then a little further down, you have an excision of a lesion of the tongue with closure. And you'll notice that the first code is the anterior 2/3, the second posterior 1/3, and then the third is with local tongue flap. And there's even a parenthetical note that states, do not report 41114 in conjunction with those other two codes. On national exams, one of the things that they are really trying to determine is if you can pay attention to details and apply coding guidelines. All right, under tongue and floor of the mouth, just one more family I want to look at, and that's on the bottom left-hand corner of page 305, and that's a glossectomy. And what you'll want to notice about the glossectomy codes, lots of options based upon what they actually did during that glossectomy procedure. All right, next up, we're going to go over to palate and uvula on page 306. And under palate and uvula, you'll see excision, and look, another biopsy code. So you know that in the integumentary system, there are some biopsy codes, and I hope you're seeing the difference between those biopsies and these biopsies, okay? Those biopsies in the integumentary system, they're on the skin. All right, so I want to look at 42104. This is an excision lesion of the palate uvula, and it's divided based upon whether or not closure was done, if closure was done, what type of closure. Then under repair, I want you to notice 42200, which is a palatoplasty for cleft palate, soft and or hard palate only. But then there's another palatoplasty at 42205, which is for cleft palate with closure of the alveolar ridge, and it's divided into two options. And then 42215 is a palatoplasty, and it's for cleft palate, major revision, or two additional options. All right, next up, we're going to go over to pharynx, adenoids, and tonsils, and that's on page 307. And under this particular anatomical grouping, they start off with some incision codes, incision and drainage of an abscess. And I'm pointing this out because I'm hoping that you will see that, wow, there's lots of similarities in the codes, and it's going to be critical that you pick the ones that the one that supports what your doctor did today. And again, I must continue to overemphasize on national exams, because they're multiple choice, they're really looking to see if you're paying attention to those details. All right, so under pharynx, adenoids, and tonsils, go down to excision destruction, another biopsy, and go down to tonsillectomy, 42820. So tonsillectomy and adenoidectomy is what is represented by code 42820 and 21. The big differentiator here is the age. Then you go down to 42825, tonsillectomy only code, primary or secondary. And secondary basically means that they've had the procedure done before and they had to do it again. So with the tonsillectomy only codes, they're divided by age. Then you have two adenoidectomy codes, 42830 and 31, and notice they're divided by age. Bottom of page 307, you have a secondary adenoidectomy, and then on the top of page 308, that's where you have that second code for the age. All right, next up on page 308, we're going to go over to esophagus. Now, as we venture into the esophagus, one of the things that you are definitely going to note is the differences in the some of the indented codes are very long, and so one thing that you want to pay close attention to is where did your indented code begin? So where is that standalone code for that family of codes? Because honestly, guys, sometimes the standalone code is one or two pages before that indented code. And we'll see some examples so you'll know exactly what I mean. All right, so under esophagus, we're going to first start off with codes for excision. And let's go on down to 43107, bottom right-hand corner of page 308. And here you have the esophagectomy procedures. Now, what you'll want to note on page 308 and 309, you're going to see several esophagectomy codes, and you have to pay close attention to the description and compare it to what your provider actually did. So 43107, total or near esophagectomy without thoracotomy. Now, if you stop there and go over to the top of page 309 and look at 43112, notice that also says total or near total esophagectomy. The big difference here is 43107 is without thoracotomy, and 43112 is with thoracotomy. Okay. And then you have the indented code for the colon interposition and the rest of that content. Also here, one word that you're going to see is an anastomosis. You'll want to look that word up. It's listed in code 43108, listed in 43113, listed in 43118, 43123, and that's anastomosis. That's an important term to be familiar with. Now, when you go over to 43117, I want you to notice that this is a partial esophagectomy. And there's another several partial esophagectomies starting at 43116. So very important to know what your provider is doing, to what extent, what body part. All right, next up, we're going to go to esophagoscopy. And as I'm sure you know, esophagoscopy is a procedure where they put in a flexible endoscope. And whenever you see the word endoscope, that just means that it's a scope to look within. But like esophagoscopy or an esophagoscope lets you know that that scope is designed to go directly into the esophagus. Now, on the bottom of that esophagoscope, there is like this device. I can't think about what it's called, but it's a device that actually is able to magnify the images on a video screen. And you can actually see that in this diagram here. And so the provider doesn't have to open up their body to actually explore the esophagus. Now, when you're coding endoscopies, it's going to be critical to read the operative note to see what they actually did once they got that scope in, because that is critical. That's critical. All right, so on page 309, one of the things that you will also notice, it starts off with a parenthetical note that speaks to what we do when bleeding occurs as a result of the procedure. And in those cases, the control of the bleeding is not separately reportable. Here's another reason why you have to read the rules before you code, because if you don't know the rules, how can you apply them to a scenario? And trust me when I tell you, it is something that you definitely have to get better with. And so you know, you got to just practice, okay? Let's see. So, a couple of words you need to be familiar with as it relates to the esophagoscopy, words such as rigid versus flexible. So if you notice with regards to 43180, it's stated as rigid transoral. And then for 43192, notice indented codes, okay? And so they continue on, bottom of page 309, and actually just take a look at 310. If you look at each code on page 310, you will see where the standalone codes and the indented codes, I like to say dip in and dip out. So, you know, if you are, you know, doing any marking up of your book, you know, you really want to pay close attention to this, because some of the codes really look the same. And if you're not paying attention, you can pick up the incorrect code. So for example, on page 309, those scopes say rigid transoral. But when you go over to 43197, those scopes say flexible transnasal. And a lot of times, guys, they have the indented codes have the same description, and it's that standalone code that's going to really help you make that determination. So the other thing I want you to note is, let's see. Oh yeah, so if you look at the code description, and this is very, very important, if you go over to back to page 309, if you look at 43193, notice it says with biopsy, single or multiple. So it could be one biopsy, it could be multiple biopsies. If you look on page 310 and look at code 43194, notice it says with removal of foreign bodies. And so that is important as well. All right, so let's keep on going here. So 43200 starts another family of codes. And again, if you follow the indented codes, you should notice that the rest of the codes on 310 go with 43200. And then if you look at 311, those codes are still indented, and they continue on over to page 312. So paying, close attention is really going to be critical. All right. Okay, so next up, we're going to go to another type of scope, which is commonly known as an EGD, or an esophagogastroduodenoscopy. And this is a what they call an upper endoscopy. And this is important because later in this section, you're going to see lower endoscope procedures, meaning that the scope is inserted through the anus and comes up. Here, the scope is still going in the mouth, and it's all the way down to the duodenum. Now, this code family on page 312 immediately starts off with some very important subsection notes, information about modifiers that are going to be critical. And then your very first code is 43235. Notice that this particular code has the term flexible and transoral. Trans means through or across. And with this procedure, guys, same thing like in the esophagoscopy procedure, you'll notice that they're inserting that scope and they are able to, there's a device, it's probably a camera, I'm pretty sure it's a camera, that is on the tip that allows the provider to look inside of the upper digestive tract. Okay, and the upper digestive tract, guys, is generally referred to as the esophagus, stomach, and the first part of the small intestine, which is the duodenum. So that's why it's called esophagogastroduodenoscopy, or EGD. So then the other thing I want you to notice is that the indented codes continue on over on page 312. And then, guys, look at page 314. So go back. If you go back over to page 312, you'll notice that there's a standalone code. And then page 313, you have all of those indented codes. And then when you go over to page 314, what do you notice? More indented codes. And you go over to page 315. more indented codes. If you think your eyes are playing tricks on you, go back over to page 312. Notice that 43235 is a standalone code. And then on page 313, if you look at each and every code on page 313, they are indented. And then if you look on page 314, I want you to notice that those are also indented all the way through to this code family ends. And with these endoscopies, what you need to do is read that operative report to determine what was actually performed during the scope. And if you see all of these indented codes, you see all the different things that they can do once they get that scope in. But you want to pay attention to the parenthetical notes. There are lots of parenthetical notes that say, do not report this and that. And guys, with this code family here, you could have a situation where you have more than one code from this code family. For example, if you look at 43250 and 43251, I want you to notice that they both say with removal of tumors, polyps, or other lesions. But the big difference is 43250 is by hot forceps. 43251 is by a snare technique. And so in your documentation, your doctor could remove, several tumors, polyps, or other lesions, and one could be by hot forceps, the other could be by snare, and then of course you're going to report both codes, and you're going to need a modifier, but I'm not going to tell you what that is at this point because I want you to focus on just learning about these codes. All right, next up we have on page 315 ERCP codes, and ERCP is endoscopic retrograde cholangiopancreatography. Starts off with subsection notes, and as a reminder, now is the time to read through the subsection notes, because on the day of or the month before an exam, during that time frame, like a month before the exam, that's a lot to do, to sit down, read through subsection notes, and then try to do practice questions and all of that. So it's better that while you're learning CPT coding, that you actually read your subsection notes now. So ERCP allows the physician to examine the pancreatic and bile ducts, which makes sense because of the name of the procedure. And this is another procedure where they put an endoscope in that has a light at the end of it. And it allows the physician to look at, those particular areas. And also, the particular areas I should mention. I mentioned bile duct, pancreas, but also don't forget about the liver and the gallbladder, because those are in that area as well. And you can actually see that on the diagram. So this is a procedure that allows the provider to diagnose or even treat conditions such as gallstones, cancer, or other types of strictures. So the codes themselves begin on page 316. And you got that standalone code at 43260. And then notice the rest of the codes on 316 are indented. And then on 317, all but one are indented. So 43273, which is that add-on code at the very end of that code family, is not indented. All right, next up, we're going to go to the bottom of page 317, and you're going to see the word laparoscopy or laparoscopy. Now, the one thing that I want you to really pay close attention to here, this is very, very, very important. Laparo means abdomen, right? And usually when you see laparoscopy, a lot of times you see it under the context of Most people think of it like with female reproductive system procedures, but that's not the only reason that they go into the abdomen. So on page 317, we're in the digestive system. So the laparoscopy procedures that are done for 43279, and if you turn over the page through 43289, which is on page 319, those procedures are focusing on digestive system organs, okay? They're focusing on digestive system organs. So you'll want to take note of the different options that are available here and actually what they do once they get the scope in. And that's with all endoscopic procedures, you're really looking to see how far that scope went, because that's going to impact, what you code. But then also, what did they do when they actually got in there? All right, next up, we're going to go on over to page 321, and we're looking at the stomach at this point. And under stomach, the first couple of codes, options that you have available are for gastrostomy procedures. So that's an incision into the abdomen. And once they make the incision into the abdomen, the codes are divided based upon what they actually did. When you go down to excision, look, another biopsy code. From there, you have an excision code, and this is for a tumor of the stomach. The big differentiation here is one of the codes is benign and the other code is malignant. Then you have a gastrectomy code, 43620, which is a total gastrectomy, whereas 43631 is a partial gastrectomy. And these here, guys, just as an FYI, these on this page are open procedures. That's something that's very, very important when you're coding surgery, is recognizing if the procedure is open or not, okay? Now, what you also want to notice is in the families of gastrectomy, you have total and partial, but then you also have those different options that they can do with the gastrectomy procedure. All right, on page 322, we're going to go over to the introduction area. And there's a couple of things I want to look at over here. I want to start with 43752. 43752 says nasal or oral gastric tube placement requiring physician skill and fluoroscopic guidance. So this is a patient that's getting that tube placement, and this procedure requires the physician skill. Now, there are some parenthetical notes here that you'll want to pay close attention to. All right, after that, still on page 322 as well as 323, I want to look at the intubation and aspiration procedures. And what I want you to note, 43753 is a gastric intubation and aspiration, but it's a therapeutic procedure, whereas 43754 is gastric intubation and aspiration, but it's a diagnostic procedure. And then on page 323, 43756, this is also an intubation and aspiration, but notice it's duodenal. So watch out for, the play on words, because trust me when I tell you, on national exams, that's how they trick you when you're not paying attention to details. And that's why now is the opportunity to really get into the different code families. If you need to highlight words or underline words, do that. But let me just caution you, do not over highlight your book, because it will only confuse you on the day of the exam. In that code family, they also have some options for repositioning or replacing a gastrostomy tube. Okay, on page 323, we're going to go over to the area that is titled bariatric surgery. And the first options that are listed over here are laparoscopy. Now, here, what I want you to notice, and the reason for this picture, this is actually a picture of a patient having a bariatric surgery via laparoscopic procedures. And one of the telltale signs of a laparoscopic procedure from a documentation perspective is you'll notice, look at the 4 little incisions that they made. And then if you do some additional research, you can understand why they do those 4 little incisions and what they actually put in each little incision. And you'll see words like port and trocars and different things like that. All right, so on page 323, what you're going to notice over here is that we have some options with regards to what they actually do for this procedure. So, you know, are they removing something? Are they revising something? And it's also important to pay attention to the parenthetical notes. I know I keep saying that over and over and over again, but those parenthetical notes are just, guys, so very, very important. Let's see. Now, over on page 324, there are some additional procedures that are done for bariatric patients. And again, very important, was a scope used or was it an open procedure? For example, on page 324, if you look at 43846, one of the things you'll want to notice is that there's a parenthetical note that says, hey, if this is a laparoscopic procedure, use 43644 instead of 43846. And again, I just want to overemphasize on national exams, that's how they trick you. Also with bariatric surgery, you want to make sure you're clear on what they did. You know, was it a lap band? Was it a Roux-en-Y bypass? Or was it a vertical sleeve gastrectomy? All right, next up, intestinal allotransplantation, aka a transplant, bottom of page 325. And as with other transplant procedures, we've discussed that there's basically 3 components of work for a transplant. So there, in this case, the cadaver donor enterectomy. The second step is always the backbench work. And then the third is the actual recipient transplantation. All right, next up, we're going to go on to page 326 with our colectomy procedures. And what you'll want to notice right off with code 44140 is that that's colectomy partial. And then under partial, you have indented codes for all the different types of procedures they can do. And guess that word I told you about, anastomosis, is actually here again. So 326, those are our partial codes. 327, we have several options for total. And again, you know, just like I've been saying, pay close attention to the differences in the code families. All right, next up, we have an enterostomy procedure, which starts on the bottom of page 327. And these procedures can also be done laparoscopically. And then, so they start on page 327 and then continue on page 328. And then there are some other options for enterostomy. Ostomy is to create an artificial opening, and entero means intestine. Always remember your terminology. All right, now we're going to go on page 329 for an endoscopy of the small intestine. And we've seen lots of endoscopies thus far. This particular endoscopy is going to focus on the small intestine, which is the duodenum, the jejunum, and the ileum. So it starts off on page 329. Of course, guys, what does it start off with? You guessed it. Subsection notes. And you know what I'm going to say next. Now is the time to read through the subsection note. Take note of anything that's important that you need to highlight. Again, you don't highlight everything. So on page 329, we have the standalone code, and then we have the different options that are available to us. And then after that, you have 43376, which is a new new option, or not a new option, but a separate option. It's a separate procedure. But also notice 44360 is a separate procedure as well. And if you've forgotten what the definition of separate procedure is, what you'll want to do is go back to the beginning of the CPT surgery guidelines, specifically page 72, to review separate procedure. All right, so after that, on page 329, then you have endoscopy stomal. And if you're looking on page 330, you should immediately see definitions of proctosigmoidoscopy, sigmoidoscopy, colonoscopy, and colonoscopy through a stoma. This here is very, very critical because patients can have an endoscope and not have an artificial opening, which means that endoscope is going to enter via a natural opening. Here, what we're talking about on page 330 is that your patient is having the procedure where the scope is going to be inserted through that stoma. The stoma is called an opening. And this is typically your patients that have some type of ostomy procedure. So on page 330, you'll actually start to see the different code options that are available. So on 330, ileoscopy is the procedure that they're doing there. And then you're going to see other endoscopic services. And then 44388, you're going to see colonoscopy. That's why they put those definitions over there on the bottom of page 330, because they want you to know the difference between colonoscopy, proctosigmoidoscopy, etc. Lots of indented codes to look at here, so please take note of those. All right, next up, I want to go on over to page 333, and here I'm looking at the appendix and the appendectomy. 3 code options for appendectomy: 44950, 44960, but then when you get on the top of page 333, you have laparoscopic appendectomy code choices. So again, I can't overemphasize, you got to know if the procedure was open, or if it was percutaneous, or there was some type of endoscope. All right, next up, we're going to go to colon and rectum, and on the bottom of page 333, you will note the proctectomy codes. They start with code 45110, and they have several differentiating factors. And look, there's that word, anastomosis, over there again. Hopefully by now you've paused this recording and you've looked up anastomosis, looked at a picture, so that you know exactly what it means. So lots of proctectomy code options divided based upon how the provider actually did the procedure. The proctectomy codes actually continue on page 334, and they're divided by things like partial and complete, as well as other differentiating factors. All right, next up, we're going to go over to page 335. And here you're going to see your proctosigmoidoscopy codes and what I want you to note here. So first things first, on page 334, those same 4 definitions: proctosigmoidoscopy, sigmoidoscopy, colonoscopy, colonoscopy through a stoma. So the first family of codes on 335 are for your proctosigmoidoscopy codes. Notice there's a standalone code with lots of indented codes. Then you go down to 45330, and then you have your sigmoidoscopy codes. And same thing here, guys, I mentioned earlier with regards to you can have multiple codes from this code family to reflect the extent of the procedures performed. So for example, let's use 45338 as an example. Notice that says snare technique. We talked about that before. But then what if they do a balloon dilation, transendoscopic balloon dilation? There's another code that could potentially be assigned. Now, as it relates to colonoscopy, I want you to note on the bottom of page 336 a decision tree for colonoscopy. And what's important to note here is that this divided into, was it a diagnostic procedure or was it a therapeutic treatment? So diagnostic means that they're trying to diagnose something. Therapeutic means that they're treating something. So you have to ask yourself, and this is what this decision tree is looking at: did the surgeon reach the splenic flexure? Did the surgeon examine all the way to the cecum? And so you have to make your code decision based on what was documented, and you just follow this decision tree. All right. So let's just go back to make sure we got everything. So we got proctosigmoidoscopy. That's on page 335. Sigmoidoscopy, that's also on page 335. And then our colonoscopy codes actually start on page 337. Okay, so pay close attention to that. All right, so next up, we're going to go to procedures on the anus, and I'm going to go over to page 340. And 340 specifically, I want to look at hemorrhoidectomy procedures. And what you want to note here with the hemorrhoidectomy procedures: was it internal? Was it external? How they actually did the procedure, how many columns were involved. On page 341 in your CPT manual, there's actually a picture of internal prolapse hemorrhoid columns, but I found better pictures on the internet that I felt that were a little bit better than this procedure, specifically with columns. So this picture that you're looking at here, you'll notice that you can actually see columns. But if you Google it, you'll be able to see some better pictures. All right, next up, I want to look at endoscopy procedures. And endoscopy procedures start over on page 341. And just like the rest of the endoscopic procedures, you got codes that show, different things that they're doing once they get the scope in. Of note, the endoscope actually looks a lot different than the anoscope looks a lot different than some of the other scopes that we've been talking about. Again, internet picture will help you with getting that visual. All right, on page 343, and we're almost done, guys. On page 343, we have liver transplant, and by now, 3 distinct components of work: the cadaver donor procedure, the backbench, and then the recipient transplantation. All right, on page 345, Whoa, when you looked at 345, you said, oh my God. So 345 is where we have codes for percutaneous biliary procedures. And this code family is on the biliary tract. And some of the types of procedures that you're going to see are certain biliary drainage and stenting procedures. But then also, you will also note a cholecystectomy procedure, and you know that's a removal of the gallbladder. As it relates to the stent procedures, there's a nice little table on the bottom of page 346. And as you review the different code families here, you're going to note words like exchange, conversion, placement, removal. Watch out for those different terminologies. All right, next up, we're going to go on over to the body part of pancreas, which is on page 349. And on page 349, you see pancreatectomy procedures, you see biopsies. And one thing I want you to notice about the biopsy procedures 48100 and 48102 is how they do it. 48100 open, 48102 percutaneous needle. And then your pancreatectomy procedures, which are on 349, the lower left-hand corner and the upper right-hand corner, divided based upon the extent and how they did the pancreatectomy. Bottom of page 349, we have a pancreas transplant, and you know, 3 distinct components of work, right? So one of the things that there are some things that are just going to stick in your head. They're instantly going to click. Others, you have to work hard at getting them to that point, but trust me, you will get there. All right, next up, we're going to look on page 354 because I want to take a look at the gastrostomy tube procedures. On the bottom of page 354, what you'll note here, we have codes for the initial placement of the gastrostomy tube. Notice they got all these different tubes and procedures that look alike. Take note in your CPT manual when you're looking at a family of codes. Go back to the body part in red to make sure that you're on the right body part. So for example, right now I'm on page 354. If you go to 353, no words in red. 352, no words in red. But if you go to 350, this is where abdomen, peritoneum, and omentum are, and that helps me understand that, yeah, I'm in the right area. Okay, so we have several options here for the insertion of a gastrostomy tube. We have codes for initial. We have codes for conversion. Sometimes they convert the tubes from one type to another. So for example, with 49446, it's a conversion of a gastrostomy tube to a gastrojejunostomy tube. Then patients will need those tubes replaced. And then we have situations where there is something obstructing the tube, and we have code 49460 for that as well. All right, guys, last family of codes in this particular area are the hernia repair codes, and we're on page 355. Now, with the hernia repair codes, you have to look at your documentation to determine what is your hernia type, what is what's known as the clinical presentation or the diagnosis. Is it incarcerated or is it strangulated? You also need to know, is this a initial hernia repair or is this recurrent? You also need to know the age of the patient. Now, the codes start off with open hernia repair codes, and then when you go over to 49560, you have and let's see where that's at. No, not 49560. 49650. Page 357. That's where your laparoscopic hernia repair codes go. And as it relates to initial and recurrent, I mentioned that initial is the first time they're doing it. So recurrent, they have previously reduced the hernia and it resurfaced. Okay. So the only other thing I want you to know here is with regards to add-on code 49568, which is an add-on code for implantation of mesh. This code is only used if the patient has an incisional hernia or a ventral hernia. Okay, 49568 is only used if the patient has an incisional hernia or a ventral hernia. So as you explore the hernia codes on page 355 and 356, don't forget what I mentioned, what you're looking for. What is the type of hernia? Type meaning incisional, inguinal, femoral, umbilical, ventral. Then you're also going to look at the clinical presentation of the diagnoses. Is it incarcerated or strangulated? Is it the initial or is it recurrent? What's the age of the patient? And then also, if the procedure was done via laparoscopy, you're going to start with the codes at 49650. All right, guys, that has been the 40,000 series of your CPT code set. Next up, we're going to jump into the 50,000 series, and the 50,000 series has a lot of different code families in them, but we will tackle those just like we've done thus far. Thank you so much for listening.